All right, my name is Esther Aimi. I am a family nurse practitioner, pediatric specialty. I've been a nurse for over 10 years. So I've worked at Yale, I've worked, in hospice, I work in pediatrics, I work in adult medicine, I worked in trauma, I worked in the ED, I've done all kinds of things. I worked during COVID, when everyone was home, we were out in the community. As nurses, as you know, we were the forefront. So I am the sole owner of Mercy Pediatrics. I am the first Black APRN in the state of Connecticut to own a pediatric practice. So this is pretty, thank you. I gotta do my curtsy. This is pretty big. I purchased the practice, and I say purchase because the practice was owned by a group of physicians, and a lot of physicians are retiring right now in the state of Connecticut. A lot of our patients are forced to drive to local areas in order to get this healthcare support that they need. We are located in the city of Naugatuck. Middlebury is close by, so we do service all that surrounding areas. So our purpose is to really support the Naugatuck area and the surrounding areas with pediatric comprehensive care. The issue right now is income. So I had a family member who explained to me that, she's the mother of 6 children. She was working at Yale. She was also a nurse, and her insurance was Blue Cross Blue Shield. After her last baby, her third baby, she had a lot of complications and couldn't go back to work. So that kind of melted my heart a little bit. So I said, okay, what insurance are you taking now? What insurance do you have? She says Husky. I said, well, that's great. A lot of physicians do not like Husky. A lot of providers do not take Husky. As many of you are nodding your heads, it has become a big issue with the medical community because 90% of our patients are Husky patients. So if we don't take this population, where are they going to get their care from? And a lot of pet providers that have Husky, their offices are not the best. They're not as clean. They're not as, people friendly. They're not high tech. So we're pushing towards that. We're really big on supporting the community. So we are here in Naugatuck to stay, and we are not going anywhere, and we're here to support the community. So the main issue right now is the distance that our population are driving to see practitioners. Now that we have been here in Naugatuck, in the past 3 weeks, I just opened this practice in January. So we have seen over 250 pediatric children, which is great. Kids are flocking in. We have a strong team that is well known in the community. The two individuals that are on my team, they've been with the old practice for the past 3 years. So they're well known in the community, and they are kind of like the face of the community, which is great, but we are working together to make sure that we keep the patients that we have. And they're so happy to have us in the community, and they're so excited to know that they don't have to drive 45 minutes to a local hospital just to get care. So the problem, like I said, is access to high quality healthcare and denial of healthcare and health services because of insurance type, right? We're taking Husky patients. We have a couple of private patients that have Blue Cross, Aetna, Cigna, United Health. So when you become a nurse practitioner, when you open your practice, we're the new kids on the block, right? So we have to be able to get credentialed with these big insurance companies. We have to prove to them that we know what we're doing. We know how to provide excellent care. And in order to sign the contract and actually get paid, you have to show that you have actual patients coming in to see you. So we're able to do that. We're able to prove to Aetna, Cigna, Blue Cross Blue Shield that we have these patients coming through our doors and that they need that support. So we have that check mark. Only problem with us is that because we take Husky, Husky pays really low. Husky does not pay a lot of money, but we don't want to turn patients away. We don't want to turn patients away because of their insurance. We still want to provide that quality health care. And I want patients to come into a place where, it's not dated. This practice has been around since 1965. I'm not going to say my age, but I'm an 80s baby. So this practice has been around before I was even born, So with that being said, now that we kind of splashed some paint on the walls and freshened up the place, I put a sign on the door that says, please excuse our appearance. So when the patients come in, they know that we're remodeling. We're trying to freshen the place up because they do deserve the best, despite their insurance. Okay, so right now we are competing with local hospitals. I have a quick story to tell. So we've been in operation we started January 3rd, and we've been in operation for like a month now, right? 2 weeks into my business, I get a nice little email from CCMC, Connecticut Children's Medical Center. And they're like, oh my goodness, you're a new practice. This is great. Let's partner. No, partner means that let me buy you out. Let me Pac-Man you. Let me take you. So I tell my husband, I'm like, sheesh, I've been in this business three weeks. and I'm getting Pac-Man'd already? Like, this is ridiculous. You know, he says, no, you're not selling anything. I said, no, I'm not selling my riches. I'm not selling my goods. We're here to stay. We're here to provide excellent quality care. We don't want to be, you know, Pac-Man by these big companies that take advantage of small businesses like us. And as these doctors are retiring, a lot of APRNs do not know their power and their strength, you know? So it's very important for me to raise awareness. Right now, I'm trying to start a YouTube channel too, to educate a lot of APRNs that look like me and some that don't even look like me on the power of our license, on the power of our degree and our ability to support our community. So caring is high quality healthcare. So our symbol has 2 Band-Aids and a heart in the middle. I actually love that symbol because when kids come into the office, kids always like Band-Aids, right? If they bump their leg, there's no cut, there's nothing. They just want a Band-Aid. So we have these specialized Band-Aids that we have. They're blue and they have a heart in the middle of it. I actually spend money to get it because I think that when the kids see that, it kind of makes them feel good. So anytime they come in, that's the first thing that they look for. So we provide high quality care by being compassionate, empathetic, and we use evidence-based research to treat our patients. We use evidence-based research by using apps and tools that allow us as nurse practitioners to practice within the guidelines and within our scope of practice. Our solution, our goal is to provide care to all. Right now, the old practice had over 2,000 patient charts. I did not purchase the patient charts. I chose not to because it wouldn't have been cost effective. It would cost me over $10K just to scan those charts into our new EMR. A lot of these patients, they're used to paper. So now we have a new EMR, which is Office Practicum. It's pediatric specific. So what it does is that it takes all the patient information before they even get into the appointment. And what it does is it provides us with a summary of what we need to do before the patient comes. How many of you go to the have children that go to the pediatrician and you have to sit and wait, fill out, sign papers and sign your life away before you can even go? That cuts into your visit. So our goal is to make sure that our pediatric sensitive EMR is able to gather all that information to provide the best quality care. And also we have on-call services. Those are very costly. If your child is sick, we need to be available. We have rotations where I'm on call and I need to be able to get back to you within 30 minutes to provide that service. So we're getting very tech savvy. And it's really, really, really important to provide patients with that comprehensive care. So like I said, at the time of this presentation, we've seen 120 patients. Now we've seen over 200. I put my own $60K into it. I actually own another business, Little Tots Play Care, which is a daycare. We service children in New Haven, birth to 3. So I put some of my funds into it. Right now we're on social media. We're on Instagram. We're on Facebook. I'm creating a LinkedIn, and I'm really pushing for a company called Remedy Connect to push our website. So our website should be up and running by March 2023. My big goal within the next few years, 5 years, is to really buy our practice, buy the space. A lot of times the kids turn 18, they age out. If I can get the second floor of that practice to service 18 and older, it'll lead to continuity of care. So there are 30% of patients in Naugatuck that have children, 22% are Husky. An average visit for a patient to come see me costs between $110 and $150 through the insurance company. But with Husky, it's a little lower than that. And we're willing to really support the patients with that. So outpatient care centers, this is us. This is our hourly mean and average. So we do make almost $100 an hour as APRNs. Physicians do make more, which is fine. We're not going to fight with them, right? But we're here to stay. APRNs are here to stay and to support the community. All right, so this is me. Chelsea is another APRN. Kristen is another APRN. I really push for diversity. Right now, if you know any APRN that's a male, Spanish speaking, we'll take them. As long as they're experienced. We're building this, collaborative approach where I want everyone to be represented in our practice. What we need the funds for, high-grade instruments. If you only knew how much just a small hemoglobin machine costs, you would cringe. So we're really pushing to purchase the items that we need. We really want to keep our EMR up to date. That's costly. We really need medications that we purchase. Vaccines this month cost us $20,000, but the good thing is the state of Connecticut provides it for free. Right? So that's a great thing. We don't have to charge patients for it, but it's a rigorous process. I've been working on getting vaccines since November 2022, and thank God 3 weeks ago we got it. So it's a rigorous process. We do need an MA. We are growing. We have a lot of patients coming in, and with us 3, we cannot contain the patient load. So I'm going to leave you with this. Public health is a powerful tool to level that playing field, to bend the arc of our country away from distrust and disparities and back towards equity and justice. A lot of people mistrust the healthcare model, but we're here to really support everyone in understanding and being more involved in their healthcare. And this is Mercy, our 1-year-old daughter. So Mercy Pediatrics was named after her. I think she might be a little surgeon. I don't know. This is her at the daycare. Playing nurse. And this is just her. So I dedicate this to Mercy Pediatrics and all the pediatric children in every community that are low income and need support. Thank you so much.
If you don't mind, what are your plans for, what do you think you really need the most importantly right now? As I'm listening, you've had quite a very fast trajectory, bringing on a lot of people needing to have access to the platforms.
Yeah.
What is, the one thing, if you can get that right now, what would it be?
A medical assistant that is certified. We are moving at a fast pace, so we do need someone to be able to support us with that. The LPN is kind of getting burned out. I kind of don't want to lose her. And the MA would be able to buffer all of that. She'll be able to be in the front to manage that while I see patients and Chelsea sees patients. So that's the key.
How much would that cost?
MAs are $18 an hour. That's certified because they have to be able to do blood work and give vaccines. So we don't want to, not pay people for what they're worth, because people do have to live.
So you talked a little bit about using technology to enhance your business. So what's your thinking around where you want to be in the space of technology by the end of 2024?
Perfect. Great question. Actually, we started using Office Practicum, and now we're using another company also to bridge Office Practicum called Pharesia. So what Pharesia does is that it takes patient information before you get to your visit. So we already signed a contract with both companies, and they're implemented, but they are costly. We also use a company called Remedy Connect, which helps us with on-call. So if your kid is sick, they have to be able to call Remedy Connect, and what that company does is filters questions like, oh, what time do you open? Non-clinical questions, so I can get the clinical questions when I get woken up at 2 a.m. Instead of answering a question like, oh, we open at 8, Remedy Connect will filter that, that phone call. So within 2024, we already implemented these things, but within 2024, it should ease our ability to, transition patients in easier, and it gives us more time to spend with the patient for the visit.
Okay. Any thinking around cross-pollinating that with telehealth?
Oh, we have telehealth. OP gives us telehealth. So all of that is a complete package. We also have a company, MCA Billing, which does our billing because you have to be very careful in healthcare. You can't just bill for anything. So MCA, what they do is they filter out all our CPT codes, which are diagnosis codes, and they let us know, hey, you can get paid for this or you can't get paid for this. So it reduces fraud, because that's a big thing. You have to make sure that your billing is accurate, you get compensated properly, and you don't have the FBI kicking down your door in the morning.
Given what you just said,
Yes.
Billing properly, and thank you, by the way, for the services you're providing.
Thank you. You're welcome.
It's critical,
Thank you.
and it's a big gap in our community.
Yeah.
And so my question is a little bit more clarity on sustainability because of the population you're serving. You mentioned that Husky doesn't pay. How do you plan to sustain providing that service to this population who needs you? I just want to get a little bit more clarity on that.
Absolutely. So, we don't cap on the patients that we see. We're going to see Husky patients. And able to sustain that, if I have to see more patients that are non-Husky or patients that come in to balance out that Husky amount, we'll do that. Once we are credentialed with the other companies, we're credentialed with 5 so far. And that's really big to be credentialed within the last 4 weeks. Credentialing takes a long time. So I've signed all the contracts already. So those private payers come to balance out the Husky cost. So it keeps it even, so we're not losing any money.
To Arthur's point, this is incredible. So when we're thinking about the future of the organization and growth over the next 6 to 8 months, what are you most excited by? What are you most interested in terms of how to get to that point of sustainability?
I'm more excited about, return of patients. Our patients are returning, which is a good thing. There's no practice that has seen this many patients in 3 weeks. So that means that we are needed in the community. So our patients they come to do their visit and they come back. So that's sustainability right then and there. If your patients leave and they don't come back, then you have an issue because you'll lose money. But because they're coming back and they're on Facebook and they're commenting Mercy Pediatrics is great, I love it. It helps us become stronger in the community, and we're becoming word of mouth right now. We're like bees right now, you know. Our patients are like our bees. We provide the honey, they come and pollinate, and then they go back and tell their friends at the hive. So it's working. It's really working.
Great, thank you.
Sorry, guys. Thank you so much.